Academy FM Folkestone is a charity, right? And we rely on donations and grants in order to run our station. One grant that we have helps train young people to interview local scientists about a question they may have. This project is sponsored by the Wellcome Trust, an organisation that helps explain science to the general public. So far this week, we've learned about why cardiac arrests happen to young fit people and how music can affect your mood. Today is the turn of Harmony, and I'll let her explain her question to you.
Yes, so that's what we're going to listen to next. Are you ready, Mel?
No.
Are you ready, Mel?
Hi, I'm Harmony and I am a student at the Folkestone Academy. I was watching Britain's Got Talent one night and I saw people popping their joints out of places and I wondered if it hurt. So I spoke to Dr. Ball, who is a joint expert, and asked him a few questions. I started off with, what is double jointedness?
Well, double jointedness is when your joints are more flexible than they should be, and the technical term, the medical term, is joint hypermobility, and it affects about 10 to 20% of the population, and it's all about stretchy ligaments. So the ligaments are like the elastic between the joints, and they become more stretchy than the average person, and then you get excessive movement in the joints, which can make your joints clicky. And for a lot of people, they just have nice flexible joints, but for some people it causes pain, and you can dislocate your joints and you can be slightly clumsy as a result. How do you know if you've got hypermobility? Well, you can look at your own joints, and this is difficult to demonstrate on a radio program, but if you think about your little finger, and if you can bend your little finger back to 90 degrees on both sides, if you can extend your thumb back to touch your forearm, and if your elbow overextends, bearing in mind your arm is normally straight, but if it overextends by 10 degrees, and the other thing is if your knees go backwards, like bananas, and also if you can touch the floor with the flats of your hands without bending your knees, those are the criteria which we call the Baton criteria, which give you the diagnosis. And if you score 4 or 5 on that, then you may well have hypermobility.
Okay. Is it painful? Because when I see people doing it, they don't really look in pain.
Well, that's an important point, because there's a difference between hypermobility and the hypermobility syndrome. Hypermobility is where you just have flexible joints and can be a huge advantage to you if you want to do certain things like dancing or playing an instrument. But if you have pain with the joints, that's where you call it the hypermobility syndrome. A small number of people with the condition can go on and develop quite widespread pain, and this is sometimes called fibromyalgia. And if that happens, you do need to get specialist advice.
Oh, wow. Can you get any other illnesses with hypermobility?
There are very rare conditions that go with hypermobility, and you won't see this in this environment, but there are rare things like osteogenesis imperfecta, which can cause fractures, and Marfan syndrome, where people are very tall and have long spindly hands. And then there's a more severe form of hypermobility called the Ehlers-Danlos syndrome, which gives you very, very bendy joints.
That surprises me, because I thought you would just get affected, it would just affect your bones.
Well, it is really the ligaments rather than the bones that are affected in the majority of people.
Are there any treatments for joint hypermobility?
I think it's very important that you keep as fit as possible and your muscles are strong. And building up your muscles by exercise helps to keep your joints in the right place and means you're less likely to hurt or injure yourself. It's important to choose the right sort of exercise and warm up properly with gentle stretching exercises. And if you've been given physiotherapy to do at home, then make sure you do it properly so you're in good shape. It may be best for some people to avoid certain sports which involve sudden stopping and twisting, such as football, basketball and squash. And these can cause knee injuries with people with hypermobility, so that needs to be borne in mind. Swimming is excellent, as water protects your joints as you exercise. And you could try running in water, which is hard work and very good exercise. Posture is really important. Slouching, kneeling with your legs stuck out either side and showing off your joint tricks to your friends can increase your pain and damage your joints, so that's important. And when you're at school, make sure your desk and chair are in the correct height and in the right position. Don't carry heavy school bags over one shoulder. Make sure the weight is carried evenly across your back, and use a backpack and wear it properly if you have one. If you're having problems with writing for long periods, get a thick grip pen. They're now available, or stick some foam around one of your old pens. And sometimes it's easier to use the computer than doing a lot of writing with pens. And think about your feet. Some people with hypermobility have flat feet. Make sure you buy shoes that fit properly. High heels are bad for ankles, and you can make things worse, so you try flatter shoes. So those are the broad guidelines.
Do you get pain in certain areas?
That is certainly true. Typically somebody might present with a knee problem, or they might have a back problem, or they might have a foot problem, and that's because certain joints are more flexible than others, and it's never necessarily in the same pace in the same individual. So it's quite important to look at the person from a holistic viewpoint in terms of where their joints are affected.
What is it that makes the ligaments more stretchy?
Well, this is all to do with the collagen, which is the protein in the elastic bands that we were talking about, and it's more flexible than it should be in people with hypermobility, and it's more prone to damage if you overstretch yourself. So if you twist your ankle, it heals up more slowly than a patient with normal ligaments. So it's the nature of the connective tissue in the body, and as a result you can get other problems as well, like when you're older in life, varicose veins, people can get hernias, in particular you can get stretchy skin. So all of these things are related to the flexibility of the collagen.
What is it important to remember about hypermobility? Well,
importantly, many people are hypermobile and never have any problems, and I think that's worth hanging on to. In fact, for many people it's a very good thing, particularly musicians such as violinists or guitarists, where the ability to stretch your joints more actually helps them play better. And also, if you're a dancer, and if you look at Strictly on Saturday evening, you'll see this. Most of the dancers are hypermobile, and it's an advantage to them. But for some people, though, being hypermobile causes pain, and they have the hypermobility syndrome. There are lots of reasons why people with the hypermobility syndrome hurt, but it's usually because the ligaments are overstretched and the muscles are weak. And doctors and scientists are working hard to understand this condition so they can come up with some solutions. But in the short term, it's important to have good physiotherapy advice, keep yourself fit, and to remember that hypermobile people have stretchy ligaments, so their muscles have to work harder to keep their joints in the right position. You can also injure yourself more easily, and it can take longer for the injuries to heal. But it's important to understand it's under-recognised and disregarded or discounted, and it's important for you to have a point of reference, which I would recommend the HMSA website, the Hypermobility Association website. And there's even a teenagers section which can be useful there, and to put yourself in contact with a physiotherapist who has a special interest in joint hypermobility.
Thank you for your time, Dr. Ball. I'm sure people will find it very interesting.
You're very welcome.